everything over to you, Tim.
Okay.
A video.
Yeah, it's not looking good for today. We're only at 25, 60-ish.
Charlie, if you want to go ahead and mute everyone first and so that Marie can speak, that's acceptable. Thanks.
Sure thing. And we are now live.
Okay, thank you. All right, thank you everyone for joining in a timely manner. We're just waiting for everybody else to log in here, and then Marie will make some opening remarks, and then we'll get started with the hearing.
Make sure your mics are muted. You probably are muted.
Okay, we only have 26 people in here right now. I'm going to wait another minute or two because we have about 70 people that's signed on to attend. So just bear with us a few more minutes. Okay, just turned 6 o'clock. I'm going to give one more minute and then we will get started. Good evening, everyone. It's 6:02. I still have some people signing on, but I'll start the introduction. This is the Regional EMS Council of New York City public hearing for Forest Hills Volunteer Ambulance Corps' application to expand their operating territory. We have a hearing officer this evening, that's Tim Hannigan. He will be in charge of this meeting this evening. And we are also live streaming on YouTube. There is a staff member on YouTube who will be collecting any questions that are asked by people on that end of the public hearing, and they will be presented to the hearing officer at the end of, to be addressed at the end of this hearing. And I guess everybody is here. Mr. Hannigan, whenever you're ready, I'll turn it over to you.
All right, I'm all set. Thank you very much, Marie. Good evening, everyone. This proceeding will now come to order. The time is 6:04 p.m. This proceeding, as many of you are certainly aware, having the past one earlier this week and previously in your EMS careers, is a public hearing in the matter of the application of Forest Hills Volunteer Ambulance Corps, which seeks to expand its certificate of need to include the communities of Woodhaven, Richmond Hill, and Kew Gardens, which are within the boundaries of the 102nd and 106th precincts in Queens and Community Board Number 9. My name is Tim Hannigan. I'm an attorney from Del Mar, New York, which is outside of Albany. I'm serving as the hearing officer for tonight's hearing in accordance with New York State Department of Health Policy Statement 0606. As hearing officer, I will moderate this proceeding and ensure that the hearing process itself follows generally accepted procedures. Following the conclusion of the hearing, I will prepare a report based on the application, all the exhibits, and the testimony and evidence produced at this hearing. That report will set forth findings of fact for the Regional Emergency Medical Services Council of New York City and for its ambulance committee. This hearing is being held, as I indicated, by the Regional Emergency Medical Services Council of New York City pursuant to Article 30 of the New York State Public Health Law, and is being conducted in accordance with the Policy Statement 0606. The purpose of this hearing is to provide a technical review and objective evaluation of the applicant's statement of need, as well as any other testimony presented. It is the intent of this hearing process, as 0606 instructs, to obtain input from the general public and from anyone else who uses, provides, pays for, or participates in the EMS system in the affected area. A stenographic and video record of this proceeding is being made. The testimony taken and all exhibits received will constitute the record in this matter. In a few moments, I will indicate what has been received by the council and what is being marked as exhibits. In virtual attendance this evening are several members of both the ambulance committee and the regional council. For purposes for the applicant's knowledge, you can waive for the applicant and for any members of the public here this evening. Members of the ambulance committee and members of the council will be permitted to ask questions should they any testimony and presentations to be made will be directed to the ambulance committee of the regional council. The committee members, as I indicated, may raise questions individually or may confer with one another and ask direct questions to a particular speaker or to the applicant. To support the pending application is the applicant's burden to demonstrate public need. Public need is defined in Policy Statement 0606 as the demonstrated absence, reduced availability, or an inadequate level of care in ambulance or emergency medical service available to a geographical area which is not readily correctable through the reallocation or improvement of existing resources. In this matter, the application was deemed complete on February 11th, 2021. As a matter of housekeeping, the redacted application, it being redacted for personal identifying information of the officers and directors of the applicant, has been marked and it will be incorporated into this proceeding as Exhibit 1. A copy of the legal notice of the public hearing, which was published prior to this hearing date, together with a supporting affidavit and notice of the application, which was made by registered or certified mail by the REMSCO to the chief executive officers of all general hospitals, ambulance services, and municipalities operating within the county where the applicant seeks to operate, has been marked as Exhibit 2. The letter of fitness and competency from the Department of Health attesting to the applicant's fitness and competency to operate the proposed service remains pending. When received, that determination from the Department of Health will be incorporated into this proceeding as Exhibit 3. The timeline entitled Account of Events, which was prepared by Council Executive Director Marie Diglio, is incorporated into this proceeding as Exhibit 4. At this time, I will commend Marie for compiling everything and making it very organized. She certainly made my job and I trust the jobs of the council members much easier for her due diligence ahead of time. The PowerPoint presentation transmitted by the applicant to the REMSCO before the public hearing is received and is incorporated into this proceeding as Exhibit 5. That is the PowerPoint presentation that the applicant will use in its initial presentation this evening. There was an email transmitted by Attorney Jeffrey Reisner on behalf of the applicant prior to today's public hearing with an attachment, the attachment being a blank copy of the New York City REMSCO's Conflict of Interest Agreement. That email and attachment are received and are incorporated into this proceeding as Exhibit 6. To start, we will commence with a presentation by Mr. Aviv Citron and Mr. Alan Wolf, representatives of the applicant. I note that their attorney, Mr. Reisner, is also present. Mr. Reisner, to the extent that you wish to participate in the initial presentation, you're certainly welcome to do so. Thereafter, the floor will be open to those individuals who have requested to speak. Each person requesting to be heard in the public forum will be allowed a reasonable amount of time in terms of minutes to speak, offer their comments, and make any presentation. The list for tonight's hearing is fewer than 10. If people get somewhat long-winded or tend to repeat or focus on items other than public need, I may chime in and ask them to direct their comments on the issue of public need only. At the conclusion of the public forum, the applicant will be afforded an opportunity, if it desires, for additional time for the limited purpose of rebuttal. Rebuttal time is for the limited purpose of contradicting or disproving statements or submissions made or offered by persons who are opposing the application. The time allotted and the subject matter for rebuttal is limited in scope, and it exists solely because the applicant is the one that carries the burden of proof in this hearing and on the application. I will now call the names of the individuals who are registered to speak. At the time I call a particular speaker, I will also indicate who's up next. I will now recite the names of the speakers who have indicated that they will speak this evening. Mr. Citron and Mr. Wolf will be presenting on behalf of the applicant. Thereafter, in public forum, we will hear from Alan Thorne, member and officer of Forest Hills Volunteer Ambulance Corps. Then Heidi Chain, President, 112th Precinct Community Council. Then Mr. Neil Gianelli, Chief of Staff of Senator Joseph Adabo. We will then hear from Kevin Mahoney, speaking on behalf of Ridgewood Volunteer Ambulance Corps. Mr. Mahoney noted that he will be speaking in opposition this evening. And we will also hear from Andrew Combs, Director, Woodhaven to Richmond Hill Volunteer Ambulance Corps, Inc. Mr. Combs indicated that he will speak in opposition this evening. Is there anyone else who did not pre-register speak or who did pre-register but whose name I did not call that wishes to be added to the list for this evening? If so, you can indicate it in the chat and we'll have Charlie or Marie and I add you to the list appropriately.
Tim, I'd like to speak. Dr. Louis Rockowitz.
All right. And Doctor, who are you representing? Any particular entity this evening? And do you plan to be support or opposition?
I'm absolutely in support. I'm stunned that somebody could not support this. I'm an attending physician in the emergency room at Queens General Hospital in Jamaica, and this would definitely affect our hospital. I'm also
okay. Hold on 1 second, Doctor. So what I'm doing is just a matter of housekeeping right now, figuring out who will speak. We will get back to you as far as your comments. You'll have the floor for a period of several minutes to communicate and talk about the public need as you believe exists in that area. Is that all right?
Absolutely.
All right. Good man. Thank you. Anyone else, in addition to the doctor that whose name I did not read off, that would like to speak this evening? All right, hearing none. Charlie, are there any in the chat that indicated they would like to speak?
None has indicated.
Okay, all right. With that, if anybody has any issues at the time that they go to speak and the technical difficulties, what have you, I will hold your place and put you down at the end of the list so that if you are able to sign on, please try and do so and we will get back to you. If you have your, yes.
I'm sorry, I just wanted to, I forgot to say it at the beginning of the meeting. We do have a stenographer here this evening. So when you are called upon to speak, please state your name and your affiliation before you start speaking. Thank you.
All right. Does the applicant have any questions for me before they begin their presentation?
Yes, you mentioned, I think that it was either the first or second person on the list. I didn't recognize the name.
First is Alan Wolf and Aviv Citron.
Okay, the third, the next person.
Alan Thorne.
Okay. Thank you.
You're very welcome. All right. There being no further questions, we will proceed with the applicant, Forest Hills Volunteer Ambulance Corps by Mr. Alan Wolf and Mr. Aviv Citron.
Thank you. Can you make us presenters, please?
Sure. Charlie, are you able to do that for purposes of the PowerPoint?
Oh,
Yes, you should be able to do it now.
Okay. Thank you.
and who wants to be the presenter? Is it Alan?
Wolf.
Okay. Okay, Alan, your co-host. Go ahead.
Okay, thank you. Can you see the green screen?
Yes, we do.
Okay. Okay, well, I don't know why I don't see it. Hold on one second, please. Hold on one second. Just having some technical difficulties here. I don't see what we're presenting.
So on the screen right now for all participants, it says, "Who are we?" And it's a
Okay.
blank screen with your logo at the bottom right-hand corner.
Got it. It's not. Okay.
All right,
Introduce yourself.
good evening. I'm Aviv Citron, the safety officer at the Forest Hills Volunteer Ambulance Corps.
And I'm Alan Wolf. I'm the vice president at the Forest Hills Volunteer Ambulance Corps.
First, we would like to begin by thanking Executive Director Marie Diglio, the staff of the New York City REMSCO, members of the ambulance committee, Hearing Officer Hannigan, and everyone who's joined us at tonight's meeting. Tonight, the Forest Hills Volunteer Ambulance Corps is here to present application for expansion. We are going to demonstrate the need for volunteer ambulance service in this underserved areas since 2016. The members and executive committee of the Forest Hills Volunteer Ambulance Corps are committed to providing quality community volunteer ambulance service as we have been for 50 years.
What is it? We're having some technical difficulties. It's not. Okay. Are you guys seeing all of the photos coming out?
Yes, we are.
Okay. Okay.
I'm sorry, this is the court stenographer. I can't guess at who is speaking because you're on the same screen. So if you're gonna go back and forth, I'm sorry, you're just gonna have to state if it's Alan or Aviv because it's I don't know your voices. That's all. I appreciate it. Thank you.
Understood. We'll do that. That was Aviv, by the way.
I'll just narrate it. We are the Forest Hills Volunteer Ambulance Corps. We were established in 1971 to service the Forest Hills community. By the way, this is Alan, sorry. In 1996, we expanded to service the underserved area of Regal Park. What is special about the Forest Hills Volunteer Ambulance Corps? A rich history, celebrating 50 years of service to the community, 50 years of emergency and non-emergency transports, something that the municipal EMS agency doesn't do regarding non-emergency transports that we are able to provide for the community. CPR, Narcan, at no cost to the community. Blood drives, health fairs, outreach to schools, youth services and training. We have a robust youth squad, and we've made many youth members into EMTs, and many have also gone on in medical professions, both as nurses and doctors and other fields. We do a lot of education for the community. We have many community partnerships that we're very proud of. The NYPD 112 Precinct and the 112 Precinct Community Council we work closely with, the Fire Department of New York, many civic associations, support groups, Girl and Boy Scouts, many not-for-profit organizations, hospitals and healthcare organizations, Mount Sinai's mammography program, many business owners. Forest Hills Volunteer Ambulance Corps is a dedicated group of civic-minded individuals who strive each and every day to improve the community as a whole. Thank you.
All right. Does that conclude your initial presentation, Mr. Wolf?
Yes.
All right. Do members of the ambulance committee or the regional council have any questions for the applicant?
This is Jim Downey, ambulance committee member.
Sure. Go ahead, Mr. Downey.
All right. You guys broadcasting from Texas? I don't see any masks on.
We're both vaccinated completely, fully, and COVID tested negative.
Okay. Going to the description and map of the proposed area of expansion. On page 15 of your application, you have a map that outlines the area. Is that accurate?
This is Aviv. That is accurate. This was the map that was used by the Woodhaven Richmond Hill Volunteer Ambulance Corps when they operated.
All right, I would agree with that. On page 10, there's an area of expansion, more or less narrative. Is that accurate?
Give me 1 second. You said page
10 of 92 of the redacted application.
And again, this is Aviv. And are you referring to where it says 1 Kew Gardens, 2 Woodhaven, 3 Richmond Hill?
Yeah.
I believe that is correct in correlation with the map provided on page 15.
All right, I question it because on Kew Gardens, A, describes Jackie Robinson Parkway east to Hillside Avenue. Do they intersect?
Oh, I see what you're saying.
And as regards the map, it shows it going south to 109 Avenue. I do not see any south 109 Avenue listed on the proposed area of expansion.
Stand by, Jim. Give me 1 second. I'm just reviewing the map as you're speaking so I could understand exactly what you're saying. Yeah, so with regards to, let's start with page 10. On under 1A, where it says Kew Gardens, New York, zip code 11415, letter A being Jackie Robinson Parkway, East Hillside Avenue. That is a typographical error which should read Jackie Robinson Parkway to the Van Wyck Expressway.
All right, I would question that because the map shows Jackie Robinson to Queens Boulevard and then down to the Van Wyck. Possibly we could clear up these discrepancies subsequent to the meeting, if that's okay with the hearing officer. Also on page 14 of 92, population demographics. There are descriptions of Woodhaven, Richmond Hill, and Kew Gardens, which do not exactly correspond to the descriptions on page 10. It would be appreciated if they could be reconciled, page 10, page 14, and page 15, to the satisfaction of the hearing officer before the report is submitted. Thank you.
Thank you, Jim.
Thank you, Jim.
Yeah, Mr. Downey, your suggestion is amenable to me and to the applicant, either Mr. Reisner or Mr. Wolf, Mr. Citron. What's your timeline as far as being able to provide that?
24 hours.
Okay, all right, that's acceptable. Thank you. Mr. Downey, in terms of information needed for the committee's review, would you like a new map and narrative description of the territory?
According to the information that I have from the old Woodhaven, Richmond Hill Volunteer Ambulance Corps, the map accurately describes their service area.
Okay.
So I think what we need is something that corresponds to the map.
Okay.
All right, this is Aviva, duly noted, and you'll have that within 24 hours.
Okay, thank you. And you can copy Marie Diglio on that as well, please.
Yes, sir.
All right, does any other member of the ambulance committee or the regional council have any questions for either Mr. Wolf or Mr. Citron? Mr. Orlansky.
Good evening, everybody. Thank you, hearing officer Hannigan. I'm going to ask the same question that I did on Tuesday night in the interest of fairness, and just a brief answer, if possible. We all know, for those that were not here on Tuesday night and are here tonight, obviously there's two agencies that are competing for the same territory. So the question that I have, and obviously without being disparaging to any other agency, what makes Forest Hills I guess the better choice to get the CON for this area?
This is Dan Mizels from the Ambulance Committee and the Regional Council, and I just kind of wanted to fundamentally ask the same question as Scott, but I want to add one little point which perhaps might help clarify in terms of what makes this agency position better for this expansion. According to the map as currently provided, the contiguous area of the current service of Forest Hills Volunteer Ambulance Corps consists of exactly 4 linear blocks of contiguous area with the proposed expansion area, whereas the competing service that is also vying for the same area shares approximately a 2.5-mile border with their contiguous area for the new area, for the new region. So perhaps, adding on to Mr. Orlansky's question, which is really the salient question here, would you please describe how that geography might work in Forest Hills' favor versus the competitor?
Where are we? Hi, this is Alan. Thank you guys for your questions. The first part, why is Forest Hills a good candidate or the better candidate? What makes Forest Hills the better choice for the CON? As described in our opening presentation, Forest Hills Volunteer Ambulance Corps is very deeply involved in community outreach and providing services in addition to the basic ambulance service on emergency and non-emergency transports to the community. As demonstrated in some of the photos, we are extremely active when it comes to community organizations, the other civic organizations, the other non-for-profit organizations, school outreach, youth outreach. We have a robust program to educate the community in CPR, Narcan, Stop the Bleed. We pay a lot of attention to things other than just responding to emergency calls. However, we do that as well, and we do that very well. We also haven't expanded since 1996. The Forest Hills Volunteer Ambulance Corps started in 1971 because there was a resident who needed EMS, was in cardiac arrest, and the EMS provider for the city couldn't provide an ambulance in time, and the person died. And it was at that time that it was necessary to establish a volunteer ambulance corps. Later on, the Forest Hills Volunteer Ambulance Corps saw that there was a need in our neighboring community of Regal Park. And in 1996, we expanded to cover that underserved area. Now, in 2021, we see that there's a need in a neighboring community or neighboring communities, namely Woodhaven, Richmond Hill, Kew Gardens. And we are committed to providing that service to those communities, as we have done for 50 years to the Forest Hills and Regal Park communities as well.
Thank you very much. Yeah, that was a very detailed answer, and I appreciate it. And Mr. Downey, just for the record, I too have been vaccinated, and I'm not wearing a mask.
Do any other members of the ambulance committee or the regional council have any questions for the applicant?
This is Dan Mizels again from the ambulance committee and the regional council. I'm not sure that that response accurately answered my question relative to the geography. So I'm a little more curious about why Forest Hills Volunteer Ambulance Corps thinks that they are better positioned geographically to provide service to that area versus the competing volunteer ambulance service that is applying for the same expansion.
This is Aviv Citron from Forest Hills Ambulance. Thank you, Mr. Mizels, for your question. In response to that, as you stated, we're 4 linear blocks from the border of the Kew Gardens community. And as we explained in our application, our average response time is anywhere between 3 and 5 minutes, which is well below the national average. Granting us that expansion into these communities will continue to show that our response time will remain as such as we described, whereas a 2.5 mile distance from another applicant's headquarters is that much greater.
Does that answer your question, Mr. Mizels?
Not really, but let's move along. Thanks.
Okay. All right. Very, very good. Do any other members of the ambulance committee or the regional council have any questions for the applicant? Okay. Do we have any, Charlie, on your end in the comments as far as questions?
No questions in the chat.
Okay, thank you. Mr. Wolf and Mr. Citron, I have a few questions. First, is it the applicant's position that public need does exist within the area identified on the map in your application?
Yeah, this is Aviv. Thank you, Mr. Hannigan. We believe that there is a need, as it was demonstrated on Tuesday at the other expansion hearing.
Okay, that being for Ridgewood Volunteer Ambulance Corps?
Yes, sir.
Okay. In your application, I'm looking at page 12 of the redacted application. There's you raised a good point. It's point reallocation of resources. And at the bottom, it says, currently we see no other viable alternative to the deficit left when the previous agency dissolved. With respect to the pending application that you noted in the pending hearing that this regional council just had on Tuesday, would you change that statement? Can both entities coexist? Is there sufficient public need that exists for both entities? I would just like you to comment on that.
Hi, this is Alan. How are you?
I'm doing well, thanks.
Prior to the public hearing on Tuesday, members of the Forest Hills Volunteer Ambulance Corps asked for a meeting and had a meeting with members of the Ridgewood Volunteer Ambulance Corps with the intention of supporting each other's expansion application. We feel that it would be viable to have multiple ambulance services covering the same area. You know, volunteer ambulance services are hard to come by these days, and the more the merrier. You know, especially when there are natural disasters, man-made disasters, weather disasters, the city's resources are depleted, and the fact that your community has a volunteer ambulance service just increases the ability to get emergency medical services and ambulances to people who are in medical need. And it guarantees that those communities are served. We would have no problem, and we feel that that area has been so underserved since 2016 that more the merrier. And yes, we could coexist.
Okay, and is it your position that public need, or at least enough public need, exists to support more than one agency, that being your agency and Ridgewood at this time?
Absolutely.
Okay, do any members of, there's a comment in the chat, looks like there's a question for the applicant by a Mr. Baranko.
Yes, Vincent Baranko, ambulance committee member. Based on your just last question to the applicant, I would like to know if the applicant would be willing to split the area with the other applicant.
So good. This is Aviv. Thank you, Mr. Baranko, for your question. So as Alan stated, prior to the Tuesday hearing with the Ridgewood Volunteer Ambulance Corps, we offered many different options to coexisting in those areas. One option was that we hopefully are both awarded the area and we could work together with each other. And then there was another option where if we were able to present to the hearing officer, New York City REMSCO, and or the Department of Health, that maybe splitting the areas would be another option. As Alan Wolf stated just a minute ago, we believe that it's in the best interest of the residents, visitors, and guests of those areas to have as many medical resources as possible. Whereas if somebody would call 911, it would show a much better position of the volunteer ambulance corps to have multiple ambulances, 2 different ambulances or 3 different ambulances for that matter, show up to help. So did that answer your question, Mr. Baranko?
Kinda, but what if there was to be a split of the area? Would you guys be okay with a split instead of both ambulance companies covering the same area? If you were to split the area, would you guys be willing to do that? It's just a question.
This is Aviv again, Mr. Baranko. The answer to your question is absolutely yes.
Thank you very much.
Hi, this is Alan. To answer that question even more in depth, I just want to go back to how this issue came about. We were very deeply troubled as an ambulance service to have a neighboring ambulance service have their CON taken away in 2016. Prior to that, when we saw that they were having some trouble, we reached out to the Woodhaven Volunteer Ambulance and we offered assistance. We offered assistance with them to be allowed to use our building as a headquarters and to work out of here. We offered to them any resources that we had. we are very committed to the idea that all of these communities need to have volunteer ambulance services. So to answer your question, it doesn't matter to us if we have to coexist, if we need to split the area. In the end, as long as the area is covered, we are happy. We feel that we are a viable ambulance agency and that we have 50 years of experience, and we have a dedicated membership who feels that they can provide this service in addition to our 2 current areas at Woodhaven, Richmond Hill, and Kew Gardens. In the end, we just want the communities to be covered, and we feel that Forest Hills is a good, viable organization to do that.
So totally agreed. I believe the whole entire area needs to be covered by a volunteer ambulance company. Volunteers are instrumental to the area. But I'm glad you guys are willing to split if that's what it comes down to be. Thank you.
Absolutely. Thank you.
Mr. Wolf, I had a follow-up question, that being, following Woodhaven, Richmond Hills dissolution or cessation of operations in that area, did your agency respond or routinely provide mutual aid to that area?
We did at some point have mutual aid with Woodhaven, Richmond Hill. I'm a little foggy on the actual years and dates and times, but there was an established mutual aid agreement. They were a part of the West Queens mutual aid agreement. So yes, we did provide mutual aid.
Okay, thank you. Do any other members of the ambulance committee or the regional council have any questions for the applicant? Mr. Reisner, as counsel to the applicant, do you have anything you'd like to add before we proceed to public session?
I do. Thank you, Hearing Officer Hannigan. I'd like to join my clients in thanking the members of the committee, the council, yourself, Hearing Officer Hannigan, and Ms. Diglio for all their hard work in connection with putting this hearing on and in these challenging times. It's nice to be together with everyone, even if it's via Zoom. I also would like to say that it is my great pleasure and honor to represent an organization like Forest Hills, who is making this application for all of the right reasons. And I believe that the narratives of Mr. Citron and Mr. Wolf just now really embody that in a way that makes my heart feel good. And I think that that really is the most direct response to Mr. Orlansky's question about what makes Forest Hills the better option here. I think that it's absolutely undisputed that a need exists in this area. I haven't heard one person say anything other than that. I think that the Forest Hills Volunteer Ambulance Corps has a very rich history that's rooted deeply in their dedication to their community. They have what I like to call the hearts of teachers. And at their core, they're public servants who serve without the expectation or desire for remuneration, which is really what volunteerism is all about. And what, until things took a bizarre and sideways step a number of years ago, what the volunteer ambulance corps were designed to be and do. I think that also as part of their charm, the Forest Hills Volunteer Ambulance Corps is very modest about their financial condition, their wherewithal, and their plans to serve this community if granted the expansion of their CON. We've talked at length about their willingness to purchase new ambulances, which they have the financial wherewithal to do within their own funds. Their desire and intention to stage those vehicles inside the expansion territory so that there is the continued upkeep of those exceptional response times that they currently provide in their territory. And there is a commitment within the people of the Forest Hills Volunteer Ambulance Corps to staff those vehicles and those staging points. And really, I think that that speaks volumes to the commitment, the fiscal discipline, and the just tremendous volunteer wherewithal that my client exudes. In short, I think that Forest Hills has really demonstrated that they're not in this for the money. They're in this to make sure that the people of these communities get the best possible service. And I think that that, in a nutshell, is really what makes them the better choice, because we are talking about volunteer ambulance corps here. And to me, the choice is clear, and I hope that the council and the committee will see it the same way, as well as yourself, Hearing Officer Hannigan. Thank you very much for the time. I would reserve my time for rebuttal, any remaining time that is, and I would ask that I maintain the ability to unmute myself in the event that I need to object if any opposition speakers get too far afield.
So, Mr. Reiser, you'll certainly have time in rebuttal with respect to any other speakers going far afield or saying anything objectionable. I'll handle that. And obviously you will have the opportunity to respond in rebuttal to any comments stated in opposition to the application. Do any members of the ambulance committee or the regional council have any questions for Attorney Reisner? And seeing none, Charlie, any indicated in the chat on your end?
No indication.
All right, very good, thank you. We'll move into the public hearing comment. First on the list is Alan Thorne. He's listed as a member officer of the applicant Forest Hills. Is Mr. Thorne here? I do not see him present. Charlie, do you see Alan Thorne in the meeting?
I do not see him present in this meeting.
Okay, very good. We will move on then to Heidi Chain.
Mr. Hannigan?
Yes.
I'm sorry, this is Alan. I just want to, for the record, there's nobody with that name on that's an officer of this ambulance service.
Okay. Okay, very good. Whoever it was signed up, so we'll move on. That makes it pretty easy. Is Heidi Chain, President, 112th Precinct Community Council?
Yes, I am.
Please proceed. The floor is yours.
Okay, thank you so much. To the Regional Council, the Ambulance Corps, Mr. Hannigan, Ms. Diaglo, thank you for this opportunity. I'm speaking publicly for myself. I do have a few positions in the community, though, that I just would like to have on record. I am designated by New York City Office of Emergency Management as the district leader for the CERT team for Community Board 5 and 6. My other capacity, I am elected and have been elected for many years as president of the 112th Precinct Community Council. In both of these roles, the safety of our community, in times of an emergency are extremely, extremely important to me. We have partnered with the Ambulance Corps, and they have provided training for our volunteers. They have provided training for community members numerous times. They provided basic first aid. They provided stop the bleed. They provided, for the CERT, they provided their facility that we could hold meetings back in the day when we held meetings. They have always been there as a partner with us. They have been out there in our community at our community events. We have held health fairs. We have done a tremendous amount of outreach. They are there. They are distributing health information, safety information, and they are a valued partner in the community. So much so that we have given them awards numerous times to thank them for their efforts in the community. As a resident growing up in Rego Park and in Forest Hills, so I've been here my whole life. Unfortunately for my family, there have been times I've needed to rely on them in the emergency area, and they have been there. They're professional and they have been great. So in the different hats that I have interacted with them, they are a valued member of the community. I can testify that they do care about community service. I've seen it. I've been with them. and I appreciate it. And thank you for this opportunity. And if anyone has questions for me, I'll be happy to answer.
Thank you, Ms. Chain. Do any members of the ambulance committee or the regional council have any questions for Ms. Chain?
Dan Mizels again from the REMSCO, the Regional Council Ambulance Committee. So I don't think that anybody either at the previous public meeting on Tuesday nor at tonight's meeting have anything bad to say about any of these volunteer ambulance services, particularly their consistent and ongoing terrific services to the community. However, and perhaps this is more a question for Mr. Hannigan. With all due respect to the lady from the 112th precinct, the areas that we're talking about here do not include the 112th precinct. So, we appreciate all the great work Forest Hills has done there, without a doubt. And again, as a paramedic that has worked in Queens West for almost 30 years, I have had nothing but terrific experiences with Forest Hills myself. That said, I guess for Mr. Hannigan, do we have folks from the 102nd precinct or the 106th precinct community council, on the board to speak today to perhaps offer their opinions about how this particular agency might benefit their areas?
Mr. Mizels, for this particular hearing, we do not have persons pre-registered to sign up or otherwise participating. I was going to ask Ms. Chain essentially that same question, though, with respect to this particular area and the area that's the subject of this hearing. Ms. Chain, do you have any awareness or knowledge of whether that particular area is in need of ambulance service such that public need exists in that particular area?
What I can say to you is that they have been a valued partner and provided excellent service to our community in the ways that I am talking about, and I am not aware of other people providing that training in the neighboring communities. So okay. I cannot, I don't live there, I live here. Okay. I can discuss with great detail the training, I can discuss with great detail their outreach to the community. I can discuss in great detail things like that. To the extent that I truly believe in not only, as I said, the precinct councils, but also with the CERT, that this is really needed and that this type of outreach should be in each and every community. So with that knowledge, I can say, yes, I do believe it should be in every community, but I am not aware of what is over there right now, if that helps.
Okay. That does. Very good. Thank you very much for your comments this evening. Does anyone else have any questions from either the ambulance committee or the REMSCO for Ms. Chain? Seeing none. Charlie, any on your side?
None.
All right.
Thank you then for the opportunity.
We'll next go to Chief of Staff Neil Gianelli from Senator Joseph Adabo's office.
I'm not sure he's here. Hold on.
Yeah, Marie, I'm not seeing him on the grid either. What we'll do is I will mark him and call him at the end. We'll move him to the bottom in an effort to continue the hearing. Next up is Kevin Mahoney, speaking on behalf of Ridgewood Volunteer Ambulance Corps, Inc. Mr. Mahoney?
Mr. Hannigan, thank you.
You're welcome.
Tonight, I am here to represent the Ridgewood Volunteer Ambulance Corps. An ambulance corps for these proceedings is not represented by council, but is represented and supported by people who care. People who care for our community and people who care for other first responders. I would like to recognize the great work that the members of the Forest Hills Volunteer Ambulance Corps do for their community of Forest Hills and Rego Park. My intention this evening and during this testimony is to only present facts in relation to the application submitted and not defame or make allegations that would deter the ambulance committee and members of this council from making the appropriate decision, which is entirely based on the guidelines addressed in New York State Department of Health Policy Statement 0606. With that being said, tonight we're here to speak about the merit or lack thereof for the Forest Hills Volunteer Ambulance application to request their agency to expand services. First, it appears the application that's made available on the public record is not complete. The application is missing the required New York State Department of Health application for new service, expansion of primary operating territory, or transfer of ownership form, known as DOH Form 3777. Additionally, the affirmation of fitness for one of their directors is incorrectly complete. Page 9, Section 13 of the application, which is headed Need of Expansion in the Proposed Area. The applicant provides no statistics that support a need for expanded EMS services to the proposed area. They only provide statistics for all of Queens from 2018. No additional information or date ranges from the last 2 to 3 years of data were provided to substantiate a trend of increased response times in the proposed area. Additionally, the applicant indicates that their average response times between 3 to 5 minutes in this section, and also tonight in their testimony. But on page 7, section 6 of their application, they claim their response times are between 2.5 and 4 minutes. Is there data to back this up? Or were both of these response times metrics, which contradict each other, place the application with no merit? Or was it just placed in here to look fruitful in the eyes? Page 10, section 14, headed Area of Expansion. The section provides a conflict with the map provided in Appendix A of the application. Additionally, the applicant includes Community Board 9, City Council Districts 29 and 32, State Senate Districts 10, 14, 15, the NYPD 102 precinct, and the NYPD 106 precinct. As many of you know, City Council districts and State Senate districts change every 10 years or so based on census data. Additionally, the 102 and 106 NYPD precinct boundaries will now encroach completely in the areas currently served by the Lindenwood Volunteer Ambulance Corps and the West Hamilton Beach Fire Department and Ambulance. Page 12 of their application, section 20, headed Government Support. The applicant writes, quote, "In all conversations, we received 100% for both a need and desire to have our services available to them and their constituents," end quote. This completed application shows support from one elected official that currently is the proposed area and no others. Page 12, section 21, headed Community Support. It reads, quote, "The Forest Hills VAC has spoken with community members in the area we desire for the expansion. Based upon our conversations with these residents and business owners, the need and want to have a community-based ambulance service is evident. However, due to the COVID-19 pandemic, we have been unable to attend in-person meetings with these communities as they have been canceled. The Forest Hills VAC will, however, provide letters of support from the residents of communities we seek to serve," end quote. Now, one letter of support has been included in their application from any resident, business, community group, or civic association as indicated in their application submission. To reference the COVID-19 pandemic as the reason why they were not able to gain community support is erroneous. Frankly, it's an excuse that should not be accepted by this council or from anybody in the EMS community. Staff members of this council, members of various committees, as well as members of the EMS community in this state and nation have showed they adapted and overcame extreme levels of operational and personal adversity during this pandemic. One would have to question if the pandemic is the real reason for the lack of support letters. New York State Department of Health Policy Statement 0606, page 5, paragraph 5 states, quote, "All applicants shall focus how the proposed service will meet the definition of public need. Their narrative and endorsement shall respond and document issues related to the definition. Statements of want, desire, feelings, or any other unsubstantiated sentiments are not acceptable," end quote. Today, we are here to hear testimony to help the Ambulance Committee and the Regional EMS Council render a decision on the application submitted by this applicant. The purpose of this hearing is to provide technical review and an objective evaluation of the Forest Hills Volunteer Ambulance Corps Statement of Need. This applicant bears the burden of proof for the demonstration of public need. This applicant has not done that. This applicant has expressed wants and desires. We ask that all the parties involved in this hearing and the process determine that this applicant has not demonstrated public need to expand their services based on a lack of merit. I'd like to also address Mr. Wolf's statement earlier. We received a call March 1st, 6:13 p.m. from Forest Hills' captain, asking to sit down less than 24 hours before our hearing. We have been in contact and we're trying to communicate the Forest Hills Volunteer Ambulance Corps. First email, October 26, 2020, sending them a letter of solicitation, asking them and letting them know what we're doing. 11/13/2020, return certified receipt letter sent to them, a letter of solicitation, letting them know all our intentions. 12/7/2020, emailed their captain asking if there was an update. He emailed me back. I'll find out right now. Never heard back from him. 12/27, we received a letter from the Forest Hills Volunteer Ambulance Corps requesting our support for their expansion application. On 1/19, it's Forest Hills submitted their expansion application with some corrected letters as it was stated at the REMSCO meeting. 1/21, sent a letter to the Forest Hills VAC president and captain, asking them and inviting them to our board meeting on February 7th, 2021. They never answered, never responded. But the night before our public hearing, they asked us to meet with them, requested things that I would have to bring back to a board of directors and not able to do within a 24-hour period. The time to talk was 2 to 3 months ago. The time to talk wasn't less than 24 hours before our public hearing. I'd like to thank everybody for their time and support.
Thank you, Mr. Mahoney. Do any members of the ambulance committee or the regional council have any questions for Mr. Mahoney?
I do.
Mr. Orlansky, go right ahead, sir.
Hi, and I know that the subject of this evening's hearing is not the Ridgewood Volunteer Ambulance Corps' Certificate of Need application, but since it was brought up, Mr. Mahoney, I'm going to ask the same question that Mr. Baranko asked before of the Forest Hills crew. I will ask of you, is Ridgewood willing to consider a splitting or a sharing of territory?
Thank you, Mr. Orlansky. As we stated in our public hearing, we have a legal binding agreement with the Woodhaven Richmond Hill Volunteer Ambulance Corps Corporation that requires us to apply for the area that they previously served. We would be in breach of contract if we were to not fulfill that requirement. Additionally, if we were to ask and I would have to go back to our board would have to speak to their board, and we would have to come with an amended agreement, which would take some time.
I apologize. So the answer is, since I'm a simple person, yes or no?
If it's a yes or no answer, it's something I can't give you a yes or no on at this point. Like I said, we have a legal binding agreement with another corporation in which we would be in breach of contract with if we were to say yes to that.
Understood, but it's something that if your board would agree, then you would consider.
Our board would have to agree, then we would have to go amend an agreement with another corporation's board and address it.
Understood. Thank you.
You're welcome, sir.
Do any other members of the ambulance committee or the regional council have any questions for Mr. Mahoney? Seeing none, Mr. Mahoney, I had one follow-up for you. The question I asked and posed to the applicant for tonight's hearing with respect to mutual aid, has your agency prior to today had occasion since Woodhaven closed to respond either routinely or on an ongoing basis in the area sought for expansion by this application and by your agency's own application?
Before the New York City Volunteer Ambulance Citywide Mutual Aid Plan was put into place, which voided all previous plans, the Western Queens Backup Association existed, and it was a backup agreement between Ridgewood, Glendale, Middle Village, and the Woodhaven Richmond Hill Volunteer Ambulance Corps and Forest Hills.
Okay,
So to answer
thank
your
you.
question, yes.
Mr. Hearing Officer?
Yes.
Jerry Gelbard from the REMSCO Ambulance Committee.
Go right ahead, sir.
Just for a point of information, once an EMS entity loses or surrenders their ambulance operating certificate, it does not permit mutual aid under Advisory 1203. So therefore, no agencies would have been able to provide mutual aid in the proposed expanded area. So they can only answer prior to.
Okay. Correct. I was not, of course, if Woodhaven no longer exists, there's nothing to be provided to it. But my comment was to that particular area. Has anybody else, whether FDNY or any other agency, have they had to run calls in that area due to some lack of service or, as relevant here, public need in that area that was not otherwise met by existing providers? Mr. Mahoney?
I'm sorry, I thought you were addressing Mr. Gelbart. I didn't know you were addressing me.
No, yeah. So I wanted to go back to the question. Have from the time that Woodhaven ceased to have an operating certificate or otherwise didn't operate, did you run calls in the affected area?
We provide a mutual aid for each other, yes.
But after Woodhaven closed, obviously you can't provide mutual aid to an entity that doesn't have. Go ahead.
Exactly. Before their certificate was surrendered, we had a mutual aid agreement. Obviously, once they didn't exist anymore, you can't go into a territory that you're not allowed to by the DOH.
Okay, very good. Thank you.
No problem, sir.
Does anyone else have any questions either from the Ambulance Committee or the REMSCO for Mr. Mahoney? Hearing none, we'll go to Dr. Rockowitz. Dr. Rockowitz, are you still on?
I'm on the air.
Thank you very much. The floor is yours.
Hi, my name is Dr. Louis Rotkowitz. I'm an attending physician at Queens Hospital Center in Jamaica. I can say with certainty we would, this involves my emergency department. I have over 10 years experience working in emergency medicine in Queens, throughout Queens, all over Queens. I serve as a telemetry physician for the fire department. But I'm going to speak from my experiences. My patients are telling me that this is necessary. We're in the midst of a crisis. This is a public health crisis. My patients are the ones that are forgotten. I work in a safety net hospital. They oftentimes tell me they wait 20 to 30 minutes for ambulances. These are folks that live in Ridgewood, Kew Gardens. They come from all over. This is necessary. EMS needs as much help as we need to start cooperating. We need as much help as possible. I've worked with Forest Hills Ambulance. I've taught for them. They're extremely professional. This is a very legitimate, well-run, well-oiled organization. They follow all the rules. Things are followed to a T. But again, I'm telling you from my personal experience, my patients are telling me, the patients that come from these affected areas that we've spoken about and you guys have argued about boundary lines. These are where my patients come from. And they've waited 20 to 30 minutes, sometimes more, for ambulances. And I'm not talking about just in the pandemic. This is necessary. During the pandemic, the fire department was receiving 6,500 calls, 65,000 calls per day. 6,500, forgive me, 6,500 calls per day. I looked at the statistics. Usually they get like 5,000 calls per day. We know there's a shortage. All these EMTs are going to, they're going to fire suppression. Again, I can't speak for the fire department, but again, I can only speak for what I'm telling you now. My patients are the ones that are affected, that could be affected by this, that could be helped by this. And I'm here tonight to be their voice. They need help. Okay. This is New York City. Nobody should wait 20 to 30 minutes for an ambulance. I don't know. I think we should all stop arguing about boundary lines and semantics and applications and I can attest for these people. These are qualified people at Forest Hills. I'm confident they can get you the information that's needed. But again, I'm telling you now, from the experience of my patients, I talk to my patients. That's all I have to say. Thank you for the time.
Thank you, Dr. Rakowski. And I know you have you're due at the hospital somewhat shortly here, but I had a quick question for you and follow up, and then I'll allow members of the ambulance committee or REMSCO to ask. With respect to the experience of your patients as communicated to you, is it your opinion that a public need exists in this area sufficient to support the addition of 2 additional ambulance resources in that area?
Tim, without question, there is a public need. I swear to you, there's a public need. I see it night after night, day after day. Any available help is appreciated. This is a no-brainer. They are telling me, the patients are telling me, they are oftentimes waiting 20 to 30 minutes for an ambulance at times. And this was even before COVID.
Have those wait times become worse since the onset of the pandemic last year?
Without question. But I do have to say, I was knocked out. I had worked up until the surge, then contracted COVID myself. And, sitting in my, I just don't understand how people are arguing over this thing. Having personally myself become a patient, nearly lost my life from this thing. And then, coming back to the emergency room and speaking with patients and, just, again, my hospital, we're a safety net hospital. We serve those who are forgotten. And, organizations like Forest Hills have a very, very good relationship with the community. Oftentimes where these folks feel comfortable, like reaching out directly. I've had nothing but positive interactions with Forest Hills and other organizations, other volunteer organizations. These people are qualified, they're capable, they're well-credentialed, they're well-spoken people. They deliver a good quality care. And to lock them out is nonsense.
Thank you, Doctor. Do any members of the ambulance committee or the council have any questions for Dr. Rodkowitz?
This is Dan Mizels again, member of the ambulance committee and the council, and I could not agree with Dr. Rodkowitz any more. As the organizational representative for New York City Health and Hospitals, which is the public safety net hospital system of the city of New York, there is no question that there is a need in these areas for additional ambulance service, whether it's 1, 2, or 12 additional volunteer ambulance corps that would help get these patients to where they need to be in a time of need. There is no question about the public need. I think, though, that to Dr. Rodkowitz's point, I think that obviously we're here addressing the Forest Hills application, but I think given the fact that we have representatives from Ridgewood here as well, I think that it underscores not just the public need that we all appreciate here in this city, but it also underscores the need, again, to Dr. Rodkowitz's point, that these 2 agencies perhaps talk about how together they may better serve these areas where there is an obvious need for additional ambulance service. So again, I completely agree with Dr. Rockowitz, and I would encourage the for want of a better expression, the dueling volunteer ambulance services to perhaps get back to the table together and discuss ways that they can work together to provide services across this underserved community.
Thank you, Mr. Mizels. Does any other member of the ambulance committee or the regional council have any questions for Dr. Rockowitz? Seeing none, Charlie, any on your end?
Questions for Dr. Rockowitz?
You said no questions?
No
Can I
questions.
Can I just
All right, great.
respond? Can I respond to Dan's comment?
Absolutely, Doctor. Go ahead.
Dan, I think the way for you to see how this organization how Forest Hills Ambulance can help the community is give them the ability to go out there and help the community. I have every confidence. These people are fully vetted by me. I would trust them with my life. Like they know what they're doing. Alan Wolf knows what he's doing. He's relentless when he wants to get something done.
And Dr. Rockowitz, again, I'm with you completely. I think that your salient points are really important, right? We have a identified public need. We have an underserved community that requires the assistance, but and there's no question that Forest Hills is qualified. As I mentioned before, I've worked in Queens for most of my 30 years as a paramedic here in New York City, and I've had numerous fantastic working relationships on calls with many different agencies, working with Forest Hills, and it's been nothing but a great experience. But I think that I could probably say the same for the competing volunteer ambulance service. So we've got two services here that are both eminently qualified, have a history of serving their communities. And I guess my point really is that I would suggest to both services, I know we've got Forest Hills here tonight, but we have representatives from the other. I would suggest to both of those services to go back to the drawing board and perhaps talk a little bit more about how potentially collaborating to serve these neighborhoods and these underserved communities would be the better public health approach that we really want to see out of our EMS system.
Dan, we're in the midst of a public health crisis. We're in the midst of a public health crisis. There's no more time to go back to collaborate. Let's go forward. Every help, whoever can help, let's help. It's now or never.
Thank you, Dr. Rockowitz. Does any other member of the ambulance committee or the regional council have any questions for the doctor?
Just a statement, Jerry Gelbart, if I may, Mr. Hearing Officer.
Yes, go right ahead.
While there's two competing applications being referenced back and forth, I believe we as a council need to refer back to 0606 and that each applicant has to be managed and reviewed accordingly into and of itself on the merits of their application and testimony provided. And we cannot use one against the other. So if one applicant, gets across the goal line, so be it, but we need to judge each application's merits individually. And that's per our policy. It's not our wants, wishes, or desires of what we'd like to do. We have to stay in the lane and give each agency a fair opportunity to provide their particular pros to the application.
That's correct. 0606 requires each application be determined on the basis of public need on its face and on the hearing thereon. Obviously, Bridgewood's was this past Tuesday and Forest Hills is tonight. With that, does anyone have any further questions for Dr. Rockowitz?
Tim, I apologize. I have to get going in.
Absolutely. I don't think there are any questions for you. So that's perfect. Okay, Doctor, go right ahead. Thanks.
I appreciate it. Thank you.
We'll next move to, I believe, Senator Adabo has joined. Senator, the floor is yours.
Yeah, Tim, thank you so much. Good evening, everyone, and my apologies for being late. I want to again thank the Regional Council and the committee for their efforts, not only tonight, but throughout the year for what they do. So thank you. Like I said on Tuesday during the Ridgewood application hearing, I have the honor of representing both Ridgewood and Forest Hills. And I tell you, I have mutual respect and admiration for both. I consider both friends. So like I said on Tuesday, I will reiterate that I support both applications, to be fair. And that's why I'm showing up tonight, to show a sense of fairness in supporting both. But the clear message really is to the Regional Council and to the committee is that I agree with the doctor in the sense that these areas are certainly in need of service. Woodhaven, Richmond Hill, Kew Gardens, given their geographic locations, given their makeup of most of their residential homes being old wood framed homes. And we've witnessed horrific fires in the sense that, and emergencies in the sense that they need, again, quick emergency services. These areas are in desperate need of service. So again, I really appreciate the decision, wherever the decision may be, for the region and the council and the committee to, again, service these constituents of mine with services from either volley core. So again, I thank you very much once again for the opportunity to speak. And again, my respect and admiration and appreciation for both Ridgewood and Forest Hills Volleys. Thank you.
Thank you, Senator Adabo. Does any member of the Ambulance Committee or the Regional Council have any questions for the Senator? Seeing none. Charlie, are you there, Charlie? Anything on your end? I see none, and Charlie has left us, so we'll proceed. If somebody does have a question, you can put it in the chat, and I will look.
Okay, Tim, thanks again. Thank you very much.
You're very welcome. Thank you.
Have a good night.
Yep. Thanks.
Charlie, do you see anyone on the chat that has a question?
Not related to the public hearing.
Okay, thank you. We'll next go to Andrew Combs, Director, Woodhaven Richmond Hill Volunteer Ambulance Corps. Is Mr. Combs available?
Part of.
I do not see Mr. Combs present. Charlie, do you see Mr. Combs present?
He actually emailed me earlier and said he might not be able to make tonight's meeting.
Okay. All right. So we will proceed then. As anyone else who signed on to this meeting whose name I have not read or has not spoken and is a member of the public wish to speak, if so, please indicate in the chat to Charlie, and we will hear you. Charlie, we'll give that about 30 seconds and then we'll proceed.
Okay, if you like, if you could check the Zoom chat for a question that's directed to you. I'm just not sure how you want to go about it.
All right, there's a question in the chat regarding the completeness of the application. The question states, question for the hearing officer. You stated earlier, this hearing is the result of an approval by the council on February 11, 2021. There's no record of this meeting on the council website, calendar, YouTube stream, etc. There's only a meeting on February 23rd. Can you rectify this? I know RVAC was approved at the January meeting and the FHVAC application was deemed incomplete at that time by the council. That question is posed by Mr. William Murphy. Mr. Murphy, that's an administrative function. I'll defer to Marie to the extent necessary, but that the issue of completeness can be determined administratively. Marie, if you want to comment on that.
That's exactly the answer. When, in order not to hold up applications, if they are deemed complete in between meetings, I confer with the leadership of the ambulance and regional council, and we administratively deem an application complete. So it doesn't always happen on the date of an ambulance meeting.
Okay, thank you. Charlie, has anyone that has not already spoken indicated they would like to speak at the hearing?
I have no indications.
All right, very good. We will then close the public hearing with respect to comments for the public. Mr. Reisner, Mr. Citron, Mr. Wolf, first, would you like to exercise the opportunity for a rebuttal?
I most certainly would. I would allow my clients to precede me in that if they so choose.
Okay, very good.
Yes, this is Aviv Citron Forestals Ambulance. We're going to defer to our counsel.
Thank you, Mr. Citron. And thank you, Hearing Officer Hannigan, and everyone who spoke today. I'd like to make a couple clarifying points with respect to the application. First, the application was prepared by my client in advance of my involvement in this matter. I did not become involved in the matter until my client became aware of the competing nature of the applications and the way that things had evolved, which, as you can tell, if you've been paying attention, has become somewhat heated. And I think that that's really sort of emphasized by the fact that Ridgewood's representative is here today attacking the Forest Hill application on the basis that it doesn't prove a need, when the entire basis of Ridgewood's application itself was the fact that there is a need. I don't think anyone can dispute that there is a need with a straight face here. I think that Dr. Rokowitz's testimony was prescient and moving. And I think that he was exactly right when he, pardon me for paraphrasing, but said essentially that this is an all hands on deck situation and the city needs help. It needs more ambulances on the street to serve more people wherever they happen to be in need. And everyone who has spoken has conceded in one way or another that the people of the Woodhaven, Richmond Hill, and Kew Gardens communities are in desperate need of more ambulance coverage. To that point, to Mr. Meisel's point and Mr. Orlansky's question about splitting territories, I think Dr. Rokowitz was right on point, no pun intended there as well, because what he's saying is this is not the time to decide who gets to go to what street. This is the time to get organizations authorized to operate and save lives. And I think that that is the mindset that we all should be approaching this situation with. We're talking about volunteer organizations. That said, when the question was asked of my client, would you be willing to share the territory? The answer was an unequivocal yes. When the question was asked of my client, would you be willing to split the territory? The answer was an unequivocal yes. When the question was asked to Ridgewood, are you willing to share the territory? The answer was we cannot. When they were asked if they were willing to split the territory up, the answer was we cannot. And the basis for that answer was that there's a legally binding agreement that prohibits them from doing that. And that's the same legally binding agreement that was not submitted to the council for consideration in connection with the Ridgewood application. And I think that that's highly problematic. We talked about this on Tuesday. I would also say that the extent to which that legally binding agreement may bring representatives of Woodhaven, Richmond Hill into the management structure of Ridgewood is potentially problematic. That organization, as we've heard here tonight, had their CON revoked. That type of action does not come down from the department without a good reason, and introducing people who were responsible for that to the management structure of a competing organization smells like trouble. I would ask that the council take all of these factors into consideration, and I would ask that the council grant my client's application for an expansion of their territory to cover the Woodhaven, Richmond Hill, and Kew Gardens areas, regardless of what the council does with respect to Ridgewood's application. Because my client's application on its merits has proven a need. The testimony here tonight has proven a need. And I don't think that anyone in this meeting can even begin to contemplate the fact that there isn't a need in this city, in this area, in this pandemic for more ambulances on the street. With that said, I will rest. And I thank you all for listening tonight.
Thank you, Mr. Reisner. Do any members of the ambulance committee or the regional council have any questions in response to the comments made by Mr. Reisner in rebuttal? I'm seeing none. Charlie, do you see any questions raised? Dr. Langsam. Dr. Langsam, hold on one second. You need to unmute.
There we go.
There you go.
Okay. My name is Dr. Langsam. I'm the chair of both the ambulance committee right now and the REMSCO. And I would like to just simply concur with what Mr. Reisner said. That is no doubt that there is proven need in that area. I don't even think that's a question. My question is whether two organizations, who for whatever reason have shown an unwillingness to work together, can work together. I think the last thing that anyone wants is two ambulances coming down the street from two different directions and then hitting each other and fighting on the streets. This has been an experience of New York City in the past, which has not worked out well. And as you know, that's the reason why there is this whole CON process. Because otherwise we would have multiple ambulances from multiple organizations all heading to one corner. I would like, and I've asked this before, both groups to give me an indication that they can work together. We've done that. This has not happened overnight as of yesterday. We've discussed this. We've asked them, can you work together? Can you come? And as of this moment, okay, I haven't had an answer. And that's a problem. And so I think we have a dilemma, which of course we're going to have to discuss at the ambulance committee. But no one doubts for a moment that there is a need. And I think no one doubts that each of the individual groups are competent to do that work. My question simply is, what assurances do we have that they will work together for the betterment of the people who live in that area? That's my question.
Hearing Officer Hannigan, I think that I would be best served to defer to my clients to respond to Dr. Langsam directly.
Mr. Wolf, Mr. Citron, you can go right ahead.
Hi, this is Alan. Dr. Langston, thank you very much for your statement and your concern. As stated earlier, Forest Hills just wants the area to be served, whether it's by us alone, whether it's by us with Ridgewood Volunteer Ambulance, whether it's us and them splitting area, whether it's us and them working together to cover the entire area. We just want the area to be serviced by a volunteer ambulance service. Forest Hills has no problem working with any volunteer ambulance service to provide coverage for any community in our immediate areas. We've worked with Ridgewood, Glendale, Woodhaven, Richmond Hill for many, many, many years. We take pride in the fact that we've had many mutual aid agreements and that we've worked well together. We share a common radio frequency that we're able to respond to each other's assistance at any moment's notice. Forest Hills is of the mindset that we want the community to be serviced, and that's all we want. So to answer your question directly, yes, we can work together.
Thank you, Mr. Wolf. To the applicant, either Mr. Reisner, Mr. Wolf, Mr. Citron, do you have any further comments to be made, or conversely, are there any further questions for the applicant with respect to the statements offered in rebuttal?
This is Viv Citron. I have none. I will defer to our counsel if he has any.
I have nothing.
What's your name?
Alan Wolf.
I'll rest pending any further questions.
Thank you, Mr. Reisner. Are there any further questions from the committee or the council? I'm seeing none. Charlie, can you confirm none?
Here.
All right, very good. The time is now 7:33 p.m. The record in this matter is now closed. There will be a transcript made of this proceeding, and I will prepare my report and submit it to the ambulance committee. The committee will meet and then make a recommendation to the council as to whether the application for expansion should be approved. That will all be done in preparation and prior to the date of the next regional council meeting, which is March 23rd, 2021. As I indicated earlier this week, all dates, times, and information regarding committee meetings and council meetings are available at nycremsco.org. There being no further business before the ambulance committee or the council this evening, I adjourn the hearing. Thank you very much, everyone, for your participation and your comments.
Thank you very much. Charlie, stop the stream.